Rickets. What is rickets? Rickets is a disease of the growing skeleton. It is characterized by failure of normal mineralization, seen prominently at the growth plates. Types of rickets. Type 1. A. Due to deficiency of vitamin D, diminished intake, example malnutrition, diminished absorption, example malabsorption syndrome, and lack of exposure to sunlight, due to disturbance in vitamin D metabolism, hepatic factor and renal factor. For example, renal osteodystrophy. Type 2. A. Defective absorption of phosphates through renal tubules as in hypophosphatemic rickets. B. Diminished intake or absorption of phosphates. Clinical features. 1. Broadening of the ends of long bones, most prominently around wrists and knees, as we can see in the given image. Second, delayed teeth eruption is noticed in infants. Third, Harrison sulcus, a horizontal depression along the lower part of the chest corresponding to the insertion of diaphragm, as given in the picture. Fourth, pigeon chest. The sternum is prominent, as we can see in this image. Fifth, rachitic rosary. The costochondral junctions on the anterior chest wall become prominent, giving rise to appearance of a rosary, as can be seen here. Sixth, knock knees or bow legs is a common presentation of rickets. Seventh, craniotabes. Seen in young infants, pressure over the soft membranous bones of the skull gives the feeling of a ping pong ball being compressed and released, as it can be seen here. 8th, bossing of skull. Bossing of the frontal and parietal bones becomes evident after the age of 6 months. Now comes the radiological features. Radiological changes are observed in the lower ends of the radius and ulna. X-rays of both wrists and knees, anteroposterior views are used for screening. Following radiological signs may be seen: delayed appearance of epiphysis, cupping of the metaphysis, widening of the epiphyseal plates, splaying of the metaphysis, bone deformities like knock knees, bow legs, and coxavara. Here, cupping and splaying of metaphysis along with widening of epiphyseal plates can be seen. Now comes the treatment part. The treatment consists of medical and orthopedic treatment. First, medical treatment. In medical treatment, vitamin D 6 lakhs units as a single oral dose induces rapid healing. If the line of healing is not seen on X-rays within 3 to 4 weeks of therapy, same dose may be repeated. Again, a maintenance dose of 400 international units of vitamin D is given per day. Second, orthopedic treatment. The orthopedic treatment consists of correction of deformities by conservative or operative methods. First, conservative methods. It is specially designed splints like mermaid splint or orthopedic shoes for correction of knee deformities. Second, operative methods. Moderate or severe deformities often require surgery, and corrective osteotomies, depending upon the nature of deformities, are performed. So this was all about rickets. See you next time. Thank you.